Chapter 13 is skin. At this point, you should know where to find the objectives. The skin prevents water from getting in and fluids from leaking out. It can block pathogens from getting in. It helps us to feel through touching. It helps to synthesize vitamin D and is the largest organ. Sebaceous glands are located in the skin and produces oil that lubricates while inhibiting bacterial growth. The sweat glands are also in the skin that help to maintain body temperature and water content. Hair, whose follicles are located in the skin, also help with temperature control. The nails protect the tips of the fingers and toes. There are 3 layers to the skin. The epidermis, epi is above, the dermis, and the subcutaneous layer. The outer layer of the skin is the epidermis. The lower layers are responsible for nourishment. The epidermis is made up of epithelial, squamous, and basal cells, melanocytes, and keratin. The dermis, or corium, is the thick layer under the epidermis that contains connective tissue, blood and lymph vessels, nerves, hair follicles, sebaceous and sweat glands, and nerve endings. The subcutaneous level is below, sub, the skin and connects the skin to the muscles. It consists of loose connective and fat tissue. Located within the dermis of the skin is the sebaceous gland. This is where hair follicles secrete sebum to lubricate and protect the skin. The sweat glands are responsible for sweat. Mammary glands are the milk-producing glands, but because they are modified sweat glands, sometimes they are classified within the integumentary system, although I have never seen that in the 40 years I've been a nurse. Hair is made of fused proteins colored by melanocytes, or cells filled with melanin. The follicles hold the root of the hair and determine if the hair is straight or curly. The erector pili is the tiny muscles that attach to the follicle that causes the hair to stand up, like on the back of your neck when you see a ghost. The nails, or unguis, fingers or toes, are keratin plates that protect the dorsal surface of the distal bones of the digits. What does the sebaceous gland do? Secrete sebum that lubricates and protects the skin. Here are some medical specialties related to the integumentary system. Which surgeon is responsible for reconstruction? Well, we know it's not A or D because they're not surgeons. Plastic surgeon. What does subcutaneous mean? So break it down. Sub means under. Which answer is under? Under layer of skin. These are examples of surface lesions. Crust is a scab. Eschar is a crust-like tissue associated with a full thickness wound. Macule is a flat spot. Papule is a raised spot. Verruca is a wart. These are all listed in your text. This shows you the location and the depth of the most common lesions. Because they are surface lesions, they occur on the surface of the skin. These are fluid-filled lesions. A cyst is any fluid-filled sac. Also is one of the root words for bladder, remember? Cyst. Vesicle is a small blister and a bulla is a large blister. Pustule is just what it sounds like, pus-jule, filled with pus. Abscess is a closed pocket of pus. Purulent is producing or containing pus. These are lesions that penetrate through the layers of the skin. Abrasion or scrape. Fissure is a crack. Laceration is a wound. Ulcer is an open lesion. And pressure ulcer is caused by what? Pressure. Other lesions can be those that we are born with or birthmarks. Here's a list of commonly occurring birthmarks. What is a fluid-filled skin lesion? So, a plaque is a scaly skin lesion. Verrucae are warts. A nodule is solid. So what does that leave? Abscess. It's filled with pus. Problems occurring with the sebaceous glands are acne, blackheads, cysts, or benign skin growths such as seborrheic keratosis. Problems with sweat glands are listed here. Anhidrosis. A means without, right? So without sweating, when you normally would be sweating. Hyperhidrosis. Hyper means excessive, so excessive sweating. Diaphoresis is another word for sweating. And then sleep hyperhidrosis is night sweats, which can be due to menopause or disease processes. Problems with hair can be inflammation of the hair follicles, infections of the shafts such as trichomycosis axillaris. Hirsutism is excessive hairiness. Alopecia is hair loss, either total or partial. And there are types of alopecia listed. Some examples of pathology of the nails can be clubbing, which is an abnormal curvature of the nails, which can be a sign of chronic hypoxia. Onychocryptosis, which is an ingrown toenail. Onychomycosis is a fungal infection of the nail. And paronychia is an acute or chronic infection of the skin around the nail. Abnormal pigmentation is age spots or liver spots. Chloasma is the dark spots on the face, usually due to excessive estrogen production, like during pregnancy. Albinism is a genetic defect resulting in the absence of pigment. Acanthosis nigricans is a dark discoloration around the neck and other skin folds that is a sign of certain types of cancer or diabetes mellitus. Vitiligo is the discoloration due to the depigmentation because of the destruction of melanocytes. You can also bleed into the skin, causing a contusion and ecchymosis. Purpura is multiple purple discolorations. Think purple is purpura. Petechiae are very small hemorrhages. And hematoma is clotted blood trapped in the tissue. Dermatitis is what? Inflammation of the dermal layer of the skin. It comes in several varieties. Contact, caused by contacting an irritant. Intertrigo, from friction. Eczema, which is a type of autoimmune dysfunction. And pruritus is a fancy word for itching. Erythema is redness of the skin. All of these pathologies have to do with disorders that cause the skin to turn the color purple or red. These are other generalized skin conditions. Most commonly, you will see rosacea, which is tiny red pimples and enlarged blood vessels on the face, usually on the cheeks and nose, and urticaria, which is hives. Some of the disorders are systemic, and the signs can be seen by its effect on the skin, such as scleroderma. Viral skin infections such as warts or molluscum contagiosum, or hand, foot, and mouth disease, also known as Coxsackie. Bacterial infections are impetigo, furuncles, and pyoderma, or necrotizing fasciitis. Fungus can also cause skin infections such as ringworm, tinea, that can then be located in many areas of the body. Parasitic infections include scabies or lice. These are typical skin growths. Good flashcard opportunity, I think. Callus is a thickening in the skin. Cicatrix is a scar. Nevus is a mole. Dysplastic nevus is an uncommon mole, so one to watch. Polyp is a small outgrowth of skin, and a skin tag that hangs from the skin by a little stalk is called an acrocordon. Skin cancers are actinic keratosis, which is precancerous due to sun damage. Basal cell is a cancer in the basal cell layer of the epidermis, and squamous cell carcinoma appears as sores that do not heal. Pictures say 1,000 words. Review the ABCDEs of recognizing a malignancy versus a benign lesion. Burns can affect one or all layers of the skin. It can be caused not only by fire, but by electricity, radiation, sun, and chemicals. If more than 15% of the body surface is affected, then it is serious. The depth of the burn is also taken into consideration. That is how you determine the degree of burn, is by how many layers are involved. First degree is superficial. Second degree is partial. And third is full thickness, meaning all the layers are involved. How do you diagnose disorders of the skin? You remove a sample by biopsying. You can scrape a sample or remove it through exfoliation. You can also be proactive by using sunscreen. For burns, it depends on the severity. You can use creams to treat it, or if extensive, surgery may be needed for dermatoplasty. There are many ways to remove the affected tissue. You can burn it off by cautery, you can peel it off with chemicals, with chemoabrasion, or freeze it off with cryosurgery. You can also use electricity to remove tissue. Mohs surgery is necessary for the removal of cancerous tissue. Laser and light treatments are used to treat skin pathology. Topical medications are fluorouracil for cancer treatment, retinoids made from vitamin A to treat acne and wrinkles, and steroids to help with inflammatory disorders, but over time can cause thinning of the skin. Here are some cosmetic procedures. Which one is red papules with silvery scales? Psoriasis. Common abbreviations. The most common you will see is SLE. I haven't really seen these other ones, but then again, I haven't worked in derm. What is the correct spelling for lid lift? Blepharoplasty. What is BCC? I guess it is common in this textbook. Basal cell carcinoma. Define a second-degree burn. Well, if first is superficial and third is full thickness, what looks like a partial burn, which is a second-degree burn? Blisters and damage to the epidermis and dermis.